So we need to think deeper. If we then begin to specialize, let's do and put systems in place whereby we are the leaders. As long as we don't have systems and we don't have means of monitoring them, we don't have means of staying on top. Why we do what we do, I don't know how many events you go, but the concept behind the Health and Social Care Providers Network, like Wilson has said, we are not doing this for money. If we do it for money, then it might not be viable. What we do it for is to bring people together. What we do it for is, like now, we have Andrew, you know Rumbi, she frequently comes here, but this time she's not here. But because we are creating a network, we have got a new person, maybe for the first time, Shupi. If you stand up so that people can know you, she's also a solicitor. So she deals with immigration and everything the way also Andrew does.
Can I say something?
Yes.
When I was still training, 2009, 2010-ish, around that period, she mentored me for 6 months. Wow. So she was part of my mentors.
Oh, thank you very much. You can see now, I personally didn't know that you know each other. But what we are creating here, we are not monopolizing a system. We are not going to say Rumbi Vunzwabaya is a solicitor, so we don't want other solicitors to come. No, 292 billion is so much. Even himself and with Shupi, they will never finish the business in this, because employers, we are going to flout the laws every day. So you will be full in your book, you will be full in your book, Rumbi will be full. We can go, you use your own other preferred suppliers. So that's why we are saying all the people who are, we deal with CQC with Ofsted. Sultana is there, she deals with CQC. That's why we're inviting, come, the cake is big. But the only difference is all the people who are here, they are verified. We are not the only ones, but what I know, if you go to Blue Hector and something happens with their delivery, they are accountable to the organization because they are a member. But if you find someone else out there, the consequences are also out there. But the good thing is we also have lawyers. We also have lawyers now as part of us. We might actually institute their services to deal with these service providers. So if any of the service providers here promises things which they don't deliver, tell us, because they are vetted. There's no one who just comes here and begins to talk to people. This is the system we want to create. For those who came series 1, 2, 3, we didn't have insurance. Yes, Dr. Matthew here, he then came. I think this will be the second or third time. But we are adding, and we are working as well, because I was talking to the lady there. She's from Kenya. This is also what we want to break within the healthcare sector, where it is Africanized and Zimbabweanized. We don't want that. This shouldn't be a Zimbabwean event. It should be a national. This again shouldn't be about color. By virtue of people being here, there hasn't been any segregation. I think it's again the issue of the sheep which I'm talking about, because that is the only, these are the only platforms we know. And we need to make sure we continue being part of the 292 billion. I don't even want a lot of it, I just want one. Then I leave 191 to others. You know, let's not be greedy. Yes. So, the domiciliary care market, overstretched on paper. If we are saying there is so much money, how come there are so many providers who don't have contracts? How come? Yes?
The big boys.
The big boys, that's number one. And the local authority, I was on South End on Sea last week. When I was talking to my client, we were in the office. They are running a children's service. They've got 2 children's homes, so they are registering the 3rd one. Whilst I was there, social workers were actually phoning them to say, can you accelerate the registration of your 3rd house? Because we've got more than 25 young people who are out of the county whom they want back. But you will be surprised in Southend-on-Sea. There are people, there are providers there who have houses which are empty. Do you know why that is happening? It's 1, association, 2, marketing. Those already have got 2 homes in that area, so they've been proven to be able to support. And I'm not a social worker myself, but I know if there are people who don't want a headache, they are social workers. If you are a provider and you are effective, they'll come to you. Yeah. I think Nyasha might talk about it. I don't know how he does it, but he runs quite a number of homes, more than 20 of them. But I think from what I have been seeing around, we need to deliver. We need to have these kinds of events. We then create the association, because one of the agendas which we are working on is, again, the perception of that anything run by a minority is inferior. But sometimes that is true, because we need to be upping our game so that personally, I need us to move away from this victim mentality. Let our work talk for itself. I'm in West Sussex. I've got one of my former, where I used to work, where I worked for 14 years, a company called Ashcroft Care Service. They were recruiting internationally. I was working with them. They recruited over 60 people from over various countries. The owner of the company is my actual very good friend. When we were talking, he is local British. He was not even aware. He says, I'm surprised. How is that people make other people pay to come here? The funding is there, but it is the system which is corrupt. It's the system. While the money is there, we are not accessing it. If you can see, for those, if you are setting up a nursing home or a residential, a nursing home especially, it's not viable to have a nursing home, a general nursing home with 15 or 10 people. You need a bigger establishment, which is more capital, which is why 10% of the providers are actually the ones who are getting 80% of the money, because they've got the systems, they've got the capacity. They can have a house or a home and go for 6 months paying when it is under occupancy. For you to make profit in a nursing home, you need anything between 87 and 93% occupancy, just like hotels. Hotels, they've got time where they make loss, but over a year, their occupancy should be anything from 87 to 93%, then they'll be profitable. But if you're a small provider, you don't have that capacity to absorb the loss for the next 6 months. So what I'm saying, the funding is there. If you look, supply of home care appliance, it's healthcare. The digital technology, what are you supplying? So let's move from just being the consumers of these things to becoming the providers, but we need to open our eyes, because there is 1.3 billion there, especially for those who are doing home care facilities and things to help people living in their own homes so that they are independent. What part, besides delivering the actual care, what other part are we playing? That's why I'm talking more about us diverting, moving from dom care to supported living and supported accommodation. If you can see the categories which we have, I don't know how many people are running supported living here or who intend to run supported living. How many people you intend or you are running? You are running supported accommodation. And dom care, how many? Quite a number of dom care, right? And children's services, how many? 1. Right. So when you see these statistics, dom care, quite a number, because the barriers to entry, they are low. I was talking to the people here that when you have and you are setting up your children's home, Nyasha will talk about it, or you can ask him. You can do all the setups and go for 6 months without anyone occupying that house. But the landlord or the mortgage owner needs their money. So are you able to sustain that? So that's where I will talk about quickly about, if you can see, 600 million, because this presentation is about just showing you where the money is and how you are able to access it. But there is one thing, tender opportunities there. There are more than 50 different types of tenders which you can supply to NHS. But how many of these are we on? How many services are we saying we are available within the healthcare sector to support the NHS? Because there is so much money in it. So are we focusing on the right categories of businesses before we start saying we are segregated? Some of these areas we are not even going because we don't even know them. If we don't know, what do? We have to learn. That's why we come here. That's why we now have Valor Care and Enlightening Care, who have just registered their transport services. Prior to our Liverpool meeting, they knew nothing about the transport. But now, they are in the process of registering. Now, opportunities, they are now seeing the opportunities, and they are actually saying CQC is delaying to register us because their local authorities are now asking them. Do you see? So you might be spending so much effort because dom care is overcrowded, the system is dead. Did you consider the transport services? Private transport. And sometimes you also, I think I have got my brother-in-law here who has worked in the prison services. There are serious opportunities to provide healthcare-related service to the prison services. But those tenders, you don't find them on ProActis. So you need also to know where to find these opportunities. So the healthcare sector is big. We've got the children's home there. We've got, like, I'm just rushing through because I think I'm left with 4 minutes. Innovative transport expenditure. One of the issues which I want us to really look at is partnership, because it is difficult. Most local authorities are now requiring, if you are in Devon or some of those local authorities, they are now actually asking people to form partnerships so that they participate in the sourcing process. So be open where you are amongst ourselves. Let's create the partnerships so that we put our resources together. But like anything else, like I have said, I attend a church in my area. I've been attending my church for 20 years. But one thing I can tell you, from that church which I attend, 20 years ago, it was 1. From that church, now we've got 7 churches. People coming from the church and forming their own. Coming from, and I'm saying, which God are we praying? This is exactly what then happens in business. It's all about you. You don't want to bring resources, you become one. You are more powerful. When you are one, you are more powerful. I will talk about this issue until people are tired. Every place I go, I talk about it. I come from Crawley. Crawley has got a very big Muslim community, but it has got one mosque. The whole of Crawley, one mosque. Friday, you want to go to the airport, forget. Between 1 and 2, they have gone to the mosque because they control all the taxis. At that point, money is not important to them.